In the middle of the night, you open your eyes. It's 2 or 3 a.m., maybe 4 again. Your bladder has woken you up, just like last night and the night before. You get up, go to the bathroom, return to bed. But sleep just won't come. In the morning, you wake up exhausted. The new day hasn't even begun, and you already feel drained. Or perhaps you're thinking about something else right now. You're sitting on the toilet, but the stream just won't get stronger. It takes a long time to start, stops in the middle, starts again, or stops before you feel finished. And perhaps the most uncomfortable feeling is the sense that something is still left behind. If you nodded while reading these lines, you should know. These complaints are not the inevitable price of aging. They are most likely the result of a single habit, a small, unnoticed behavior repeated 4 to 6 times a day. To change this behavior, you don't need medication or surgery. What you need is the right information and a few weeks of conscious practice. I am Dr. Thomas Muller. With over 30 years of experience in urology, I have helped hundreds of men break this cycle. On this page, I will explain exactly what this habit is, and then introduce you step by step to the technique that helps your body regain its natural rhythm. First, understand the basic anatomy. Let me pause for a moment before continuing, because what I'm about to say is truly important, and I want you to understand it. Behind what you're experiencing is a simple anatomical fact that most men never learn in their lifetime. Once they understand it, they will see for themselves why the mistake I'm about to describe leaves such deep traces. Imagine it like this. Your bladder, the urinary bladder, functions like a balloon that fills with water and then empties. Throughout the day, it fills quietly and eventually sends you a signal. Directly below it is the prostate. Although it's only about the size of a small walnut, it performs an extremely important function. It surrounds the fine tube through which urine flows out, the urethra, like a ring. So it lies right in the middle of the path the urine takes. In younger years, this ring is wide and relaxed, which is why the urine stream is strong. But over the years, especially after the age of 50, the prostate naturally begins to grow. This is a completely normal process that happens to every man. The problem is this: the more the prostate grows, the narrower the urethra becomes, just like a slightly squeezed hose. That's why the urine stream weakens, starting becomes difficult, it stops and starts again, or it stops before you feel finished. And now we come to the crucial point. In this already narrowed system, the faulty habit I'm about to explain, the behavior repeated during every bathroom visit, multiplies the strain on the prostate. A place that is already narrowed is further strained, similar to pressing on a bottle with a narrowed neck. It increases the internal pressure and damages the surrounding tissue. And this doesn't happen just once. It repeats 4 to 6 times a day, during every bathroom visit. That's why the prostate continues to swell, inflammation increases, the urethra narrows further, and the urine stream becomes even weaker. But there's an even more dangerous dimension. Due to this strong pressure, some of the urine is not pushed out the intended way, but is forced backward. This is like water splashing back when you squeeze a hose. This backflow leaves residual urine in the bladder. In medicine, this is called residual urine or incomplete emptying. This remaining urine creates an ideal breeding ground for bacteria, leading to recurrent urinary tract infections, more inflammation, and an increasing number of nighttime awakenings. As you can see, a single small habit creates a vicious cycle of pressure, swelling, inflammation, infection, and an even weaker urine stream. The long-term danger, the domino effect. With each pressing motion, the tissues in the prostate swell slightly. Even if this swelling is temporary, the daily repetition turns it into chronic inflammation. Just like a spot that is subjected to light blows daily becomes permanently sensitive over time. The more the inflammation increases, the greater the pressure on the urethra. The urine stream becomes even weaker, starting becomes more difficult, sometimes it stops, sometimes a second attempt is needed. The real big problem occurs now. Due to this pressure, some of the urine is pushed backward toward the bladder. The bladder cannot empty completely. A certain amount of urine remains. This amount can sometimes be just a few drops, sometimes a few milliliters. You might think, what does that matter? But this small amount remaining in the bladder creates a warm and suitable environment for bacteria. They multiply within a few hours. These bacteria cause urinary tract infections. The infections further intensify the existing inflammation in the prostate. Pressing, swelling, inflammation, incomplete emptying, infection, even greater inflammation. This vicious cycle is exactly what causes you to wake up multiple times at night, constantly look for a toilet, and feel like your bladder never stops. And the danger doesn't end there. In the bladder, there is a muscle called the detrusor. This muscle is the main muscle that naturally expels urine outward. It is the mechanism that creates the urine stream during urination. If it is assisted by the abdominal muscles over a long period, the detrusor gradually becomes sluggish. It begins to forget how to do its own job. This condition is called a hypoactive bladder or bladder weakness. At this point, the bladder cannot empty completely. It feels like it fills up quickly. The urge to go to the bathroom increases. Sleep is interrupted at night and mornings are tired. Sleep deprivation, in turn, negatively affects many systems, from blood pressure to immunity. The day begins tired, irritable, and listless. Over time, this condition impairs overall quality of life. That's why the behavior you call "I'm just pressing a little" is actually a serious health problem that, over the years, strains both the prostate and the bladder. The relaxed micturition technique, reversing the cycle. Now I will introduce a technique that I have been teaching my patients for years and that delivers impressive results with regular application. This technique is the simplest, most natural, and safest way to reverse the vicious cycle just described. Its name: the relaxed micturition technique. The essence of this technique is based on a very simple truth. Urination is not a muscular effort, but a relaxation process. The more you relax, the more naturally the bladder functions. Step 1. Do not delay the urge to urinate. When you feel the urge, go to the bathroom as soon as possible without delay. The longer you wait, the more the bladder stretches, and the more the natural urine flow is disrupted. This is the first step to abandoning the pressing behavior. Step 2. Position is crucial. You can also urinate standing up, but if the urine stream is weak, if there is prostate enlargement, or if you wake up frequently at night, sitting down makes the entire process much easier. Sitting relaxes the abdominal muscles, back, and pelvic floor much better. This relaxation allows the urine to flow naturally. Step 3. Consciously relax all muscles. When you sit on the toilet, wait initially without haste. Relax your shoulders. Let your abdomen be loose. Let the pelvic floor, the muscles at the very bottom of your lower abdomen, completely relax. It helps to think internally. I will not push the urine. My body will do its work itself. This mental attitude helps the body to let go. Step 4. Slow down your breathing. Breathe slowly in through your nose and even more slowly out through your mouth. You will feel your abdominal muscles relax even more. Breathing helps the bladder return to its own rhythm. Step 5. When the urine stream stops, wait patiently. This is the point where most men have the greatest difficulty. When the urine flow seems to stop mid-emptying, the old habit kicks in. Come on, I'll press a little to finish. But this is where everything changes. If, instead of pressing, you wait calmly for 5 to 10 seconds, the detrusor muscle contracts again on its own. That is, the body lets the remaining urine flow again without external force. This is a crucial step for the bladder to regain its natural function. Step 6. Don't rush. The body must be allowed to work at its own pace. Patience is the most important prerequisite of the relaxed micturition technique. It's okay to sit for a minute or even 2 minutes. The real problem is that every rush places additional strain on the prostate and bladder. With the correct application of this technique, the bladder empties better. The pressure on the prostate decreases, the inflammation subsides over time, and the number of nighttime bathroom visits decreases. 3 additional recommendations. There are 3 simple but extremely useful recommendations that make the relaxed micturition technique even more effective. Recommendation 1. Urinate sitting down whenever possible. Many men are used to urinating standing up out of habit. However, if the urine stream is weak, if the urine does not empty completely, or if you wake up frequently at night, sitting down offers a great advantage. Sitting automatically relaxes the pelvic floor. The abdominal muscles remain lighter and more relaxed. The pressure on the urethra decreases, and the bladder empties much more naturally. At first, this recommendation may seem strange, but the relief that becomes noticeable after a few days surprises most patients. This method yields very effective results, especially in men with prostate enlargement. Recommendation 2. Never rush. The toilet is not a place for a race. Many men feel pressured to be quick in busy environments, but haste is the prostate's greatest enemy. If there's no time, it's much healthier to postpone the bathroom visit and go at a suitable time, because every bathroom visit done in a hurry involuntarily tenses the abdominal muscles, triggering the same harmful cycle again. Slowing down is the most valuable gift you can give your prostate. Recommendation 3. The double emptying technique. This method is extremely simple, but its effect is truly significant. When you think the urine is completely out, stay seated and lean slightly forward. Wait 5 to 10 seconds. Usually, at this moment, a small stream of urine will still come out. This is the spontaneous flow of the residual urine that remained in the bladder. This small additional emptying reduces the risk of infection, relieves frequent nighttime awakenings, and allows for more comfortable bladder emptying. Many patients who use this method report, "I now only wake up once during the night." Frequently asked questions. Question 1. If I don't press when urinating, I feel like something is left behind, and then it dribbles a bit onto my underwear. Why? The reason for this condition is that the bladder does not empty completely, and a very small amount of urine remains in the urethra. This is the cumulative result of the harmful habit over the years. The solution is to stop pressing and use the double emptying technique. If you lean slightly forward and wait 5 to 10 seconds, the last drops will flow out on their own, and the dribbling will be significantly reduced. Question 2. Are devices or surgery required to solve this problem? Only for men with very advanced urinary obstructions, recurrent infections, or significantly impaired quality of life can urethral stents or minimally invasive procedures be considered. However, these are last resorts. The vast majority of my patients experience significant and lasting improvement through the relaxed micturition technique and the right habits, without any surgical intervention. The impact of daily habits on the prostate. Not only behavior in the bathroom, but also some habits adopted in daily life directly affect prostate health. Here are the lifestyle tips I have been recommending for years, from which my patients benefit the most. Drink water at the right time and in the right amount. Water is a vital need for the body. But not only how much, but also when you drink is important. Water drunk regularly and in small sips during the day soothes the bladder and allows urine to flow naturally. In the evening, however, especially 2 to 3 hours before bedtime, drinking too much water becomes the main reason for frequent nighttime awakenings. The recommendation is increase water intake in the morning and afternoon, and gradually reduce it in the evening. Reduce caffeine and alcohol. Coffee, tea, cola, and energy drinks stimulate the bladder and increase urine production. Alcohol not only increases urine flow, but also irritates the bladder wall. Especially reducing caffeine and alcohol consumption in the evening to a minimum leads to a noticeable reduction in nighttime awakenings. Avoid internet circulating home remedies. Sometimes patients report attempts like, "I drank lemonade with lemon, it did me good." Such methods can create a random and short-term feeling of relief, but do not offer a real solution. Cola contains a lot of sugar and caffeine and makes the bladder even more sensitive in the long run. It is always the right approach to trust scientifically proven and tested solutions. Regular exercise. Even short walks increase blood circulation in the pelvic region. This reduces both prostate inflammation and supports healthy bladder function. In combination with the relaxed micturition technique, the results of these lifestyle changes appear much faster. Summary. So far, we have discussed the most important habits that affect prostate and bladder health. Let's summarize all this information in a few clear sentences. The biggest mistake men unconsciously make for years is tensing their abdominal muscles when urinating. That is, pressing. This seemingly small behavior leads to swelling of the prostate, further narrowing of the urethra, residual urine in the bladder, recurrent infections, and multiple nighttime awakenings. Over time, this process turns into a cycle that strains both the prostate and the bladder and reduces quality of life. But the good news is, it is entirely possible to reverse this cycle. The relaxed micturition technique is the most effective method to return the bladder to its natural rhythm, relax the muscles, not force the urine flow, slow down the breathing, and wait patiently when the urine stream stops. All of this reduces the pressure on the prostate and helps the bladder work more effectively. Additionally, steps such as sitting while urinating, not rushing, applying the double emptying technique, reducing caffeine and alcohol, and drinking water at the right time significantly accelerate the recovery process. Small changes make a big difference. Many patients who apply these techniques correctly report that after just a few weeks, the number of nighttime awakenings decreased, the urine flow became more relaxed, and sleep quality improved significantly. Apply the relaxed micturition technique regularly for the next 14 days, without pressing, without rushing, focusing on breathing, and patiently waiting those few seconds when the urine stream stops. After these 2 weeks, your body will begin to send you signals: a more comfortable urine flow, less nighttime awakenings, more restful sleep. Finally, an important note: this content is for informational purposes only and does not replace medical advice. Every body is unique. If you have pain, significant changes, or serious health concerns, be sure to consult a urology specialist. Your health is your most valuable asset. Give it the attention it deserves.